So, what are our options going forward to make sure we've got a great health system for the West Coast? Well, I suppose the first thing we can do is do nothing and carry on as we are. But we'll all recall times when ourselves or our family and friends weren't able to get an appointment with the GP in a time that actually met the needs. And we'll all recall other times when the health service hasn't really met the needs that we see for ourselves or our family and friends. So I really think that doing nothing isn't an option going forward. So, option number 2. Well, we've looked at building a brand new hospital, and indeed several years ago quite a lot of work was done on exactly that. The good thing about that piece of work was that it started to get us all thinking about how we can provide our health services differently going forward. Unfortunately, the end result was a hospital with a price tag of $100 million, and for our population of 32,000 people, at the end of the day that wasn't affordable. So unfortunately, option 2 is not a goer either. So, option 3, well that's an option that I'm really excited about working in, and that's where on the West Coast our services are well connected, and whether you're visiting your GP, whether you're seeing your rural nurse specialist, whether you're visiting a doctor at the hospital, whether you're going up for a blood test, whether you need treatment for something that needs you to stay in hospital overnight, that all those services are really well connected, and we all are working together. We are sharing electronic health records. We have pathways to provide your care where we all know what the next step is for you and where we can be sure that you're getting the best quality care that we know how to provide. So a seamless, integrated service that's provided across the West Coast, and that's the kind of place that I want to work in. So the great news is that we've looked at whether or not refurbishing Graybase Hospital is going to be able to provide us with the facility that we need to support this new way of working. And the good news is that for a realistic cost of around about $38 million, we're going to be able to have the facility that's going to meet our needs going forward, and that's great for all people on the West Coast.